What's up, guys? You are welcome to my channel. Now today we are going to talk about mistakes people make when they are setting up their clinics and mistakes you should avoid when setting up your clinic. Now when you're moving in Kampala and many other places outside Kampala, you see people who have set up their clinics but with a lot of mistakes. In this video today we are going to discuss those mistakes you should avoid when setting up your clinic. Once again, if you are new to this channel, my name is Jacob, and basically here we talk about businesses like this: setting up clinics, setting up drug shops, setting up pharmacies. So if you enjoy the content, just consider subscribing to the channel. Click a thumb so that this tutorial can be promoted to other people like you, and don't hesitate to make your comment right there in the comment section. If there's anything you want to comment on my tutorial, if there's anything you want to discuss on this tutorial, or if there's any question you want to ask us on this tutorial, just make it right there in the comment section. So without wasting time, let's dive into the tutorial. Now, mistake number one which most people make when they are setting up their clinics is displaying drugs. You know, when you move around in people's clinic, you find when they have displayed drugs. When you are setting up a clinic, you are not supposed to display drugs. Displaying drugs is for Class C drug shops and pharmacies. Their licenses give them a mandate to display those drugs. But clinic, you are not supposed to display the drug. You are supposed to make a very beautiful reception with good furniture. You can even put a flower. Some people put curtains. That one is acceptable. But your drugs, you are not supposed to display them. You are supposed to put them inside there in the cupboards, but displaying them is not completely acceptable. Now, another mistake people make when they are setting up their clinic is selling drugs. Now, selling drugs is not for a clinic. Selling drugs is for pharmacies and drug shops. For them, their licenses give them a go-ahead to display and sell drugs. A clinic, you are supposed to receive your patient, take history, do your assessment, physical examination, take off labs if possible, then prescribe your drugs according to your findings. Yes, that is what a clinic is supposed to do. You should have a prescription form, then you prescribe your drugs. Selling drugs is not acceptable. Unfortunately, almost 95% of our clinics here in Uganda, they sell drugs. People come, give me Panadol, give me paracetamol, and they give. No, that one is supposed to be for drug shops. Now, these NDA guys are very funny. Someone can come with, give me some Panadol, and they see you giving. Payoka conflictus, and they see you giving. Now, when they see that, they'll get you and they take you to prison. Yes, that's one of their tricks, by the way. They try to come and see whether you sell those drugs. So when they find you selling, they'll take you to prison. Yes, it's not acceptable. A clinic is supposed to give drugs by prescription, so you should avoid that mistake. Now, another very common mistake people make when they are setting up their clinic is practicing illegal procedures. You find some people doing abortions. Those are not acceptable. You find people doing those criminal abortions. Someone has never done a D&C, is doing a D&C in the clinics, ends up perforating a woman's uterus. Those things are not acceptable. You do an SMC, yes, a circumcision. You especially male nurses. Someone has never done a circumcision. You are doing a circumcision. You are doing a hernia. You are doing dental extraction. My friend, if you don't have the qualifications to do those things, don't do them. There are qualifications. Your license for a nursing officer, there are things you are supposed to do. You are a clinical officer, there are things you are supposed to do. And a medical officer, there are things you are supposed to do. But going into procedures you've never done before, assisting in a procedure, assisting in a D&C or a dental extraction or a hernia doesn't give you a mandate to go ahead and do these procedures. Yes, you've seen, but you've not done them. Everything can be okay once you have no problem. But once you get a problem, will your license be there for you? Let me say you're a nursing officer and you are doing a hernia and something goes wrong. Will your license be there for you? We've seen very many patients, someone has cut off someone's penis, someone has broken someone's tooth. But Nange, you should avoid those procedures. Eat money in a good way, eat clean money. You can still get your money by just doing dressing, giving treatment, those things which are in the scope of your career. Yes, but trying to get money for a tooth extraction, you break someone's tooth and yet you have no idea. You've eaten money, you've not provided a good service. That money is good. Actually, that is dirty money. You've not given a good service and you've eaten someone's money. Please avoid procedures which you have no clue about. At least get someone who knows the procedures, does it, and you share the money. But trying to get like 500 for an extraction, 250 for maybe a D&C, trying to do an abortion, you have no clue about it, and then you end up messing up a woman or a client. It's not good. Try to get money in a good way. Good money is the one which has blessing. That money you eat by doing dirty things and doing procedures you have no ideas about is not good money, and you won't get any blessing from it. Another very common mistake people make when setting up their clinic is use of unqualified people who have no documents to practice. You find someone is probably a nursing officer or a clinical officer, the wife is in the clinic, the sister is in the clinic, the son is in the clinic, nursing aides are in the clinic. Those things are not acceptable because those people don't have the skills. But just because you don't want to spend money on an enrolled nurse or someone who's qualified, you put all these other people to cover you in the clinic. They don't know how to inject, they don't know the prescription of drugs, but just because you want to make it a family affair, it's not good. They find someone unqualified there, they will tell you to close. They find, even if it is a nursing aide, they are not acceptable. Nowadays, it's completely not accepted to hire one of them. They are basically just to assist you. Assisting is okay, but to be a full-time in charge, just because you are somewhere, practicing somewhere, it's not acceptable. If you want someone to cover you in a clinic, get someone who's qualified. The least qualification should be an enrolled nurse or a midwife. Anything less than that is not acceptable. If they find someone in your clinic who is not qualified, yes, they will tell you to close. They might even take that person to prison. Yes, it's very serious. So please avoid that mistake. And lastly, another mistake which you should avoid when setting up your clinic is opening up a clinic without a license. That one you should avoid it. In the previous video, we talked about people who are qualified to open up clinics. It has to be a nursing officer with 10 years, a clinical officer with 4 years, and a medical officer with 3 years. If you don't have those qualifications, work with someone who has those qualifications and you set up a very brilliant and good clinic. Don't open up a clinic without a license. If you open up a clinic without a license, your colleagues, your neighbors are watching you, and they'll go and tell those people concerned that this person has no license, and they'll get you. It's very easy to work with someone with a license and you give them a certain fee. You negotiate. How much should I give you? So you have to work with them and open up your clinic with no problem. Don't be pushed into a state where you open up your clinic without a license. They'll get you, they'll stop you from practicing, and they'll close you up, which is not very good. Get your license and display them in the corner so that everyone knows your unit is licensed to operate as a clinic. In brief, those are the 5 mistakes which people make when they are setting up their clinics, especially those who are just starting. So before you start, collect information, inquire from people who have set up their clinics before, the procedures you need to go through and the mistakes you should avoid when setting up your clinic. First, inquire, watch the tutorials on YouTube, like these tutorials of ours, which are very educative. They give you an idea on how to set up your clinic and the mistakes you should avoid when setting up your clinics. Thanks very much for watching and always subscribing to my tutorials.